Good morning, friends. Welcome back to the Morning Report. My name is Willie Lawson, and this is part two of our three-part series, Diagnosed Nation. Yesterday, we pulled back the curtain on the DSM, the Diagnostic and Statistical Manual, the so-called Bible of Psychiatry. We exposed how definitions keep expanding, how normal human quirks get labeled as disorders, how pharmaceutical influence runs through the veins of these definitions. Today, we're going deeper. We're following the money. Because the truth is, behind every diagnosis, behind every prescription, behind every therapy session, there's a dollar sign. And once you see how the money flows, you'll understand why America feels like one giant waiting room. Because this isn't about helping people, it's about building an industry where your child struggles in math class, your teenager's sadness, your own sleepless nights. It all becomes revenue. We're going to trace every dollar, examine every incentive, and expose every player in what has become a $240 billion mental health industry complex. So at the end of this episode, you'll see why the system is designed not to cure, but to create customers. Okay, let's start with the most obvious winner, Big Pharma. Every time that the DSM expands, the pharmaceutical companies are ready with a product. We saw it with ADHD. We saw it with depression. We saw it with anxiety. The moment something gets a diagnostic code, a drug ad is not far behind. Now, you and I both know these are not mom and pop companies selling herbal tea at a farmer's market. These are multi-billion-dollar corporations with marketing departments bigger than the budgets of small countries. Let me give you some numbers that'll make your head spin. Johnson and Johnson spent $2.5 billion on marketing in 2019 alone. Pfizer spent $2.9 billion. These aren't research budgets. These are marketing budgets. They spend more on convincing you that you're sick than most countries spend on their entire healthcare systems. And, and their and their business model is brilliant. It's sinister, but it's brilliant. Step one, influence the diagnostic criteria. That means lobbying the committees, funding the research, and making sure underdiagnosis becomes the buzzword. Here's something most people don't know. Of the 170 panel members who worked on the DSM-5, the latest DSM, 69% of them had financial ties to pharmaceutical companies. That's not a conflict of interest. It's a corporate board meeting disguised as medical science. All right, here's step two. Launch awareness campaigns. Not drug ads. Well, not at least at first. Just awareness. Do you feel sad? Do you have trouble focusing? How about trouble sleeping? Oh, my friends, that's half of America. Remember when shyness became social anxiety disorder? That wasn't an accident. GlaxoSmithKline spent $92 million promoting awareness of social anxiety disorder in 1999. You know what else happened in 1999? It was the year that they launched Paxil. Coincidence? I think not. Step three, make sure gatekeepers have the right information. Teachers, school counselors, pediatricians, they get pamphlets, workshops, and continuing education funded by guess who? Yes, the same company selling the pills. I've obtained some internal documents from a major pharmaceutical company showing that they specifically target pediatricians who aren't specialists in ADHD. Why? Because specialists are harder to influence. Family doctors, they see a fidgety kid. Remember the lunch and learn session sponsored by the ADHD medication manufacturers, and out comes the prescription pad. They don't have those anymore, but you know what I mean. All right. Step 4: normalize medication through direct to consumer advertising. Get the commercials rolling. Ask your doctor if is right for you. Those 8 words change the course of modern medicine. And here's the deal: the United States and New Zealand are the only countries in the world that allow direct to consumer pharmaceutical advertising. Every other developed nation looked at this and said, that's crazy. We said, that's freedom. The results speak for themselves. Stimulant prescriptions for ADHD jumped from 1.7 billion in 2002 to over 20 billion today. Antidepressants, over $16 billion annually. In the US alone, antipsychotics, nearly 10 billion. But here's the most telling part: many of these drugs don't cure anything, they manage symptoms. That means long term repeat customers. A 7-year-old on ADHD meds could still be a customer at 37. That's 30 years of guaranteed revenue at roughly $2,000 a year. Let's do the arithmetic. That's $60,000 per person over their lifetime. Now, if you multiply that by 6.1 million kids currently diagnosed with ADHD, you're looking at $366 billion in a lifetime for one diagnosis, for one age group. People, if you think these corporations don't see that math, you're kidding yourself. Now, here's where the story gets interesting. You think that schools would be the resistance, the voice saying, wait a minute, not every restless kid needs a prescription. That is not what happened. Schools have their own incentives, and they're built right into federal law. Under the Individuals with Disabilities Education Act, schools receive additional federal funding for every child classified with a disability, including ADHD, autism spectrum disorders, and various learning disabilities. The base rate is about $1,200 per kid. But for special needs students, it can jump to $7,000 or more. Let's do a little bit more arithmetic. Let's follow the money. A school district with 10,000 students, which is a fairly small school district, might have a base budget. But if they can document that 2,000 of those kids have special needs, that's an additional 12, or could be an additional $12 million in federal funding. Suddenly, those evaluations and diagnoses aren't just about helping kids, keeping the lights on, right? Listen, I spoke with a former special education coordinator who asked to remain anonymous, and this is what she told me. We had monthly meetings where we reviewed which kids might qualify for additional funding. No one ever said, diagnose more kids, but the pressure was clear because more diagnoses meant more resources, which meant job security. And here's where it really gets twisted. Once a child is in the system, once they have an individual education program, you hear them call IEPs or 404 plans, that designation follows them throughout their entire school career. It becomes part of their identity, part of their record, part of how teachers and administrators see them. The school benefits from the funding. The pharmaceutical companies benefit from the prescriptions that often follow these diagnoses. But what about the kid? The same coordinator told me this. She said, I watched kids who were just immature or dealing with family stress get labeled with disorders that followed them for years. Some kids embraced it as an excuse, others carried it like a burden. Either way, it changed how they saw themselves. But here's the most disturbing part: schools have become unofficial diagnostic centers. Teachers who may have education degrees, but mostly not medical degrees, are often the first to suggest that a child may have ADHD or some learning disability. They're the ones filling out the rating scales that inform medical diagnoses. Think about that. These same institutions that benefit financially from having more diagnosed students is the one initiating many of those diagnoses. This isn't education. This is a business model. Okay, now let's look at insurance companies. On the surface, you think that they're the losers here, right? More diagnoses, more claims, more costs. But look closely. Insurance companies are not stupid. They don't want to pay for the expensive stuff. They want to pay for the cheap, predictable stuff. And you tell me what's cheaper: years of intensive behavioral therapy with a licensed professional at $150 per session, family counseling to address underlying issues at $200 per session, or a $30 generic prescription filled every month for the next decade? You know the answer. Here's how insurance reimbursement actually works. A psychiatrist can bill $300 for a medication management appointment that lasts 15 minutes. That same psychiatrist would need to spend an hour doing therapy to bill the same amount. And many insurance plans have caps on therapy sessions. So, what does the psychiatrist do? Medication management, quick appointments, high volume, high turnover, more profit. Meanwhile, families often discover that their insurance will cover 12 therapy sessions per year, but unlimited medication. The message is very clear: pills, yes. Actual treatment, maybe. So I've obtained some internal insurance company documents that show exactly how they calculate mental health costs. They have an actuarial table that show it's cheaper to keep someone on medication for 20 years than to pay for intensive therapy that might actually resolve their issues in 2 years. That's the game. Insurance companies and pharmaceutical companies aren't enemies, they're partners. Pills keep costs predictable and patients manageable. Now, here's a piece most people will never see: the nonprofit advocacy groups. You've heard their names. They sponsor the 5K walks, they run glossy websites, they put hopeful faces on brochures. They say they raise awareness: CHADD or CHAD for ADHD, NAMI for mental health, Depression and Bipolar Support Alliance. These sound like grassroots organizations, don't they? Families coming together to support each other and to fight for better treatment. But if you dig into the IRS filings, and you will see a completely different story. CHAD, which stands for Children and Adults with Attention Deficit / Hyperactivity Disorder, received $1.2 million from pharmaceutical companies in a single year. The Depression and Bipolar Support Alliance, over $2 million from drug companies. It's a PR loop that would make Madison Avenue jealous. Here's what happens: the pharmaceutical companies fund the advocacy groups. The advocacy groups push for more diagnoses and more awareness and more treatment, meaning more medication. Families join in thinking they're part of a grassroots movement. In reality, they're marching straight into Big Pharma's business plan. Here's how it works. An advocacy group publishes a study showing that ADHD is underdiagnosed in a minority community. They hold press conferences. They train community leaders. They push for screening programs in schools. So who funded that story? Hmm. The same company that makes the most popular ADHD medication. The advocacy group gets to claim they're fighting for the underserved communities. The pharmaceutical company gets to expand their market. And families get convinced that the medication is the path to equality and success. Brilliant marketing, but it's manipulation of the purest kind. Okay, now let's talk about the professionals: the therapists, the psychologists, and the psychiatrists who are supposed to be the gatekeepers of mental health. Here's the uncomfortable truth: the current system pays them very well to diagnose and really not so well to cure. A therapist can see a patient for years with a diagnosis of major depressive disorder or generalized anxiety disorder. Insurance keeps paying. The patient keeps coming. Everybody's happy. Well, except maybe the patient who never quite gets better. What happens if that therapist actually helps someone overcome their depression in 6 months? Well, that's one less revenue stream, one less billable client. And you know what? And I'm not saying that therapists deliberately keep people sick. Most people enter the field to help people, but the incentive structure is very clear. Chronic conditions are more profitable than quick recoveries. And the diagnostic expansion we talked about in episode 1, that's been a gold mine for mental health professionals. Suddenly, there are dozens of new billable conditions. Relationship problems become adjustment disorders. Grief becomes complicated bereavement. Crappy parenting becomes oppositional defiant disorder in the kid. The number of practicing psychiatrists has grown by 40% since the year 2000, even though the population has only grown by 18%. Why? More diagnoses mean more demand. But here's where it gets pretty interesting. Most psychiatrists today spend less than 30 minutes with new patients and less than 15 minutes with follow-up patients. They become prescription writers, not healers. I interviewed a psychiatrist who asked, of course, not to be named, and this is what he told me. I went into medicine to help people work through their problems. Now I see 40 patients a day and spend most of my time adjusting medications. The insurance companies made it clear. Therapy does not pay the bills. Pills do. And those pills, they create their own problems. Side effects that require more medications, withdrawal symptoms that require gradual tapering, drug interactions that require monitoring. Each prescription creates the need for more appointments, more prescriptions, more billing opportunities. And it's not a conspiracy. It's just how the incentives work. And those incentives are driving the entire profession towards pathology and away from healing. Okay, let's just flip the lens here. Forget the corporations, forget the institutions. What does this look like for families caught in this system? Here's the bill. Initial evaluations can cost anywhere from $2,000 to $5,000 out of pocket. Ongoing therapy can be as much as $150 per session, multiple times a month. Medications, anywhere from $50 to $500 a month, depending on insurance. There's lost work hours for appointments, school meetings, specialist referrals, additional testing, new doctors, second opinions. But the real cost isn't financial. is psychological and social. Kids grow up believing I'm disordered, I'm broken, I can't function without pills. Parents live in constant fear. What if I stop the meds? What if insurance won't pay? What if the schools won't accommodate? Listen, I spoke with Sarah, a mother from Ohio. Her son was diagnosed with ADHD in second grade. So by the time he was in high school, she told me he couldn't imagine taking a test without his medication. He was convinced he was stupid without it. The diagnosis that was supposed to help him ended up defining him. And here's the kicker: families often discover that the system is easier to enter than to exit. Try reducing medications. The prescriber warns about relapse. Try to graduate out of special education services. Good luck. The school suggests continuing just to be safe. Try to question the diagnosis. Everyone from the advocacy group to the insurance companies have a vested interest in keeping you convinced that you need their services. That's not health. That's dependency. Dependency on a system that profits from the very labels it creates. Okay, here's something that should make every American, take pause and think. This explosion in mental health diagnoses is uniquely American. In France, ADHD diagnoses rates are less than 1% of children. In the United States, over 10. So are French kids just naturally better behaved? Or do they have a different approach to childhood energy and attention? In Finland, they don't diagnose depression in teenagers unless it persists for over a year and significantly impairs functioning. In America, a teenager can be diagnosed with depression and prescribed medication after a 20-minute appointment. And in Germany, insurance companies require extensive documentation and multiple opinions before providing long-term psychiatric medications for children. In America, a family doctor can prescribe ADHD medications based on a simple rating scale. The difference isn't the children, the difference is the system. And our system is uniquely profitable for everyone involved. Well, except for the families paying the price. So here's the bigger question. If the system works so well for everyone involved, pharma, schools, insurers, mental health professionals, advocacy groups, why would it ever change? Well, the answer is that it won't, not voluntarily. This self reinforcing economy, the more diagnoses there are, the more money flows, the more the system justifies its existence, the more that it justifies itself, the more the diagnoses there are. Let me give you one final stat that ties all of this together. In 1980, childhood psychiatric diagnoses affected roughly 1 in 20 children. Today, it's 1 in 6. It's not an epidemic of mental illness. It's an epidemic of billing codes. And it's accelerating. The COVID-19 pandemic created a new wave of anxiety and depression diagnoses. Telehealth made it easier than ever to get a psychiatric diagnosis and prescription. Screen time, social media created new categories of addictive behavior. Each new crisis becomes a new market opportunity. But here's what gives me hope: awareness. Once you see the incentives, once you understand the money flow, once you recognize that this is an industry selling products rather than a medical system providing healing, you can start to make different choices. You can ask more complex questions. You can demand better evidence. You can resist the pressure to pathologize every human struggle. You can remember that sadness, anxiety, restlessness, and difficulty concentrating have been part of the human experience for thousands of years. And they don't automatically require medication or lifelong therapy. Sometimes they just require time. Sometimes they just require support. Sometimes they require changes in environments or circumstances or relationships, but they do not always require diagnosis codes and prescription bottles. The money trail, friends, when you strip away the medical jargon, the compassion language, the awareness of campaigns, and what you're left with is this: mental health has become an industry that needs more customers every year to survive, an industry that sees your child's restless energy, your teen's sadness, your stress at work, not as life, but as an opportunity. That's why the numbers keep going up. That's why the diagnoses keep expanding. That's why the prescriptions never end. We've created a system where everyone profits except the people it's supposed to help. Pharmaceutical companies profit, insurance companies profit, schools profit, mental health professionals profit, advocacy groups profit. The only ones that don't profit are the families, paying the bills, managing the side effects, navigating the bureaucracy, and wondering if their loved ones will ever be able to function without the system that was supposedly there to help them. And this isn't an accident. It's not incompetence, and it's not even malice. It's the system being applied to human suffering. And like any other industry, it grows by creating a demand for its products. My name is Willie Lawson. This is the Mona Report. In episode 3, we'll step outside the institutions and look at the cultural side of how America went from a society that expected people to cope with life's challenges to a society that calls every struggle a disorder. But today, remember this: when you hear about rising mental health diagnoses, don't just think about health, think about revenue, think about incentives, think about who is getting paid. Because once you follow the money, the picture gets a whole lot clearer. The medical health industrial complex didn't happen by accident, it happened by design. And until we're willing to admit that, nothing is going to change.